during the wintertime, David Brownstein didn't know much about COVID, so he would go outside. People would put their butt out their window in the middle of the cold and inject their butt with ozone. Okay.
That's a reach.
Yeah.
Hyperbaric oxygen. Let's move on to that topic. We know this helps heal wounds. We use this for the diabetics to put them in the chamber. It helps them heal their diabetic wounds, surgical wounds, of course. What else can we use it for?
I like using it for post-stroke patients. If you catch them soon enough.
Lyme patients, mole patients.
Actually, it's almost good for every disease. Look at a lot of professional football players when they go home, they have their own hyperbaric oxygen, the plastic tank. So it's almost for every disease.
I talked to a chiropractor who healed the herniated disc with about 20 or 30 treatments.
Oh gosh.
Yeah. But the interesting thing about hyperbaric is, if you think about it, if you look at a bottle of soda, you can't tell the difference between that and a bottle of water because you can't see the carbonation. But when you take the lid off, that's when the gas will escape. So interestingly, yes, it's great to have a high partial pressure of oxygen going through your bloodstream, but it's really when the tissue gets the most benefit from it when you release the pressure. That's when it blows into the tissue. So, my thought was, if you're going to do low pressure, 1.3 atmospheres or so, it might actually be better to cycle it where you're doing like 10 or 15 minutes, then you let the pressure off, then you, increase the pressure again for another 10 or 15 minutes. And allow that to occur in the tissue like that.
Well, that's an interesting thought.
Yeah, it's like
that makes a lot.
Obviously, you wouldn't want to go from
sense.
3 atmospheres. I mean, you end up with the bends. but in a low atmosphere like that, I don't know. Just a thought, but. That's the way it was explained to me, and I would like to try that and see if clinically if there's any differences in how people feel.
That sounds reasonable. The best people would be the U.S. Navy. They know.
Yeah, right. Mm-hmm.
That's right.
Stefan, some other uses, right? Cancer. I think someone put down there. COVID, long COVID as well.
Yes.
Oh yeah, absolutely.
Traumatic brain injury.
Every disease.
Yeah. Concussions.
Yeah.
Concussion. Yeah. It's up there.
Yeah. And so, does this also cause oxidative stress on the body, or is this something safe to use long term?
I really can't think of a downside to it if you're not overdoing it.
Okay.
Yeah, I don't think you need to worry about oxidative stress. You need to worry about killing the infection.
Yeah.
Yeah.
So it can be used long term. Good. Is there any side effects of this?
Just from the pressure standpoint, sinus maybe issues or ear pain, ruptured tympanic membrane, claustrophobia.
Yeah.
Yeah, but I remember, learning med school that oxygen can be too much, right? And because
it can cause some kind of syncytial damage or something to the lung.
Atelectasis,
yeah, 100% all the time. Does something to surfactant. I don't know.
It can drive your medulla to kind of decrease the drive for respiration if you don't need it as much, right? So again, we're using this therapeutically, and patient needs to hit hard to hopefully heal and overcome it. But if someone is, just being overzealous and they're just kind of always using it, especially for these prolonged sessions, it could begin to backfire on them in some different ways physiologically as well, right?
Yeah, I would say that's too much of anything's not good.
Yeah.
I mean, too much
So-
water is not good.
In patients with chronic emphysema, COPD, is this contraindicated?
That's a good question. Because I don't think so.
I don't think so either. But they have to also practice the Wim Hof breathing and potato breathing.
Yeah, there are a lot of testimonies about that. Positive testimonies. I
Well,
don't,
you need 6.5% CO2 in your alveoli for oxygen to be released from hemoglobin. Okay, so when people mouth breathe, they don't get enough oxygen. So I have all of my patients use a cloth tape on their mouth at night when they sleep. And they don't sleep on their back; they sleep on their side. So cloth tape is usually 5 centimeters, helps them not snore, and they breathe a lot easier when they're sleeping, when they have their mouth shut with tape.
yeah. And also the mouth breathers produce less nitric oxide.
Yeah.
Guys.
They want to talk.
Yeah, they do. They're dying. Can you call them in there, hon?
I believe the COPD is just a relative contraindication just because of how they switch over from having high CO2 levels all the time